studio. Good morning and welcome to the first edition for this week. Good morning, Salon, where they come to you from the Society for Radio Democracy 98.1 FM. At this time, we want to say a very sorry to be listening via them for start late due to some internal issues and also heavy rain and storm way with the face on way coming. Well, the program na Good Morning Salon and today na Monday, July 8, 2024. We where they bring this edition come to you this Monday morning. Me na sap to you, Kalon.
And Musa Kamara na my name. Good morning. Inside the edition of the program Good Morning Salon, as Parliament don't pass the Criminal Procedure Act, the leader of government business na Parliament, Honorable Martin Sanyuma, say Parliament decide for pull come out the jury system from the Criminal Act because plenty time jurors can delay case and self-cost government plenty couple for maintain and operate them. According to the Director of Public Education and External Outreach at the Anti-Corruption Commission, Patrick Sandy, they don't drop the case of Andrew Jaya Kaikai because they not fair not any corruption pan the Mutka with them as gifts. And today inside the program Radio Democracy, they assess the health sector for effective service delivery that the well-body system.
Well, this plus other story them for inside this edition of the program Good Morning Salon. And remember say you listen we live on www.readydemocracy.sl and also the Leo Rock Metal Group, the sponsor Radio Democracy, for bringing this edition of the program Good Morning Salon come to you. From my partner radio station them, they get we live from Radio Shalom 89.5 na Kwenadugo in Falaba District, on Radio Malen 88.5, Radio Wanje 101.3 na Pujon District, Radio Kolente 90.0 na Kambia, Radio Mwa 105.5 na Kailao, Vopade Radio na Watalo, Voice of Sando na Kono District, Voice of Karine na Kamakwe on 98.0, Voice of Masoro na Pujon District, and Jange Radio on 99.3 FM na Luawabonth District. The program na Good Morning Salon, you can be part of by way I go send you message or comment to the number 077-981-981, or you go na Radio Democracy Facebook page and be part of the program on different issues they look at inside this edition of the program Good Morning Salon.
Good morning, Salon. They continue. We start for look at issues to go. Said the lead member for the Presidential Task Force on Hajj, Mohammed Ajikela, don't confirm say they do COVID test for all Salon people. We come out Hajj this year because of the COVID situation. We don't begin back na the world. He talk this for Sika. We remember them now. The Presidential Task Force on Hajj go receive about 260 pilgrim them. We come with the first batch Saturday, July 6 this year. For more on this, we join Adeyemi Jackson.
Between May 31st and June 1st this year, about 640 people been left Salon for go to Saudi Arabia for go perform one of the important pillars them na Islam, when na Hajj. During the term, where them pilgrims here begin in Saudi Arabia, then be visit different places them, like Medina, Mecca, and other side them, and self perform ceremony them, where all na part of the Hajj process. After we then spend about several weeks in Saudi Arabia for complete the Hajj process, Saturday, July 6 this year at around 7:45 in the evening, about 260 pilgrims being finally land at the Freetown International Airport as part of the first batch of pilgrims them we come out Hajj this year. After we the pilgrims go through security check, then we later take them go to the old airport. But waiting at the reason for that, Mohammed Ajikela, now the Deputy Minister of Social Welfare and self-lead member at the Presidential Task Force on Hajj, explain.
The screening process we go through now COVID screening process. And we not do screening simply because we think say they get COVID. That's not really the thing. Each and every pilgrim will come on at this country. Now a law for say before you come on Sierra Leone, you get for be vaccinated, and they all be vaccinated. They get a COVID certificates, and that makes them go. I think we they do the National Public Health Agency say we do now just precautionary because other countries then they where them people then left the Holy Land where they come back like Senegal, they find them positive. About over 100 and Senegal found positive. As you know, Sierra Leone will take a very proactive stance so it campaign. Now that makes the government give the okay for those screen there.
He continues say even though they don't do COVID-19 test, but the first batch of pilgrims them we don't come and none of them not test positive. But say they go continue for monitor them now they host them for see if they get any sign of corona inside the coming days them.
If inside we don't get positive, given the fact that they're all vaccinated, we know they isolate them like how we did do before. They're not they go to hospital, we encourage them all for go home, then take the COVID measures, then we'll be there for let them isolate themselves between 5 to 7 days now their homes them. And that time they would then did it and get for register with the local health agency, when at the DHMT, and also the nurses they go to see them as well as the social workers they go see them at their home. Once the one they don't clear, they go test them again after 5 days. If at all they don't get COVID, then they can allow them to go. But not the whole anybody in isolation.
Alhaji Mutada Sise, now the chairman for the Presidential Task Force on Hajj, talk about some party challenge them where the pilgrims then be faced during the time where they perform the Hajj.
The challenge is one again for do with numbers. Now big number they tell you about. Two, all man they in white, we all look like the same. So you go think that the person that you don't see now other person. So that you got to be very careful how you move around. Three, if you listen to your group, the leaders they waiting and they tell you now for follow. But unfortunately, some of the pilgrims them now the problem they come up. They know they follow. We go don't go tell them say now so it be then another person can't tell them they change. The challenge is then size of the population. We all there in white because now common everybody not the same king queen everybody not the same. Then also for listening to waiting the leaders of the Hajj team they say.
Alhaji Mutada Sise confirmed say out of the 640 pilgrims them we come out Salon go Mecca for go perform this year Hajj. Now only one person been die of high blood pressure.
If he says Leone, meaning we own Team OK, now only one person die of natural causes or just go Medina, but it's not related with that rumor there. However, the day for the Arafat, which now the actual Hajj day, now we can learn say some of we citizens them come through America, then you get difficulty. So immediately I talked to the ambassador. I said, well, this is no matter who side them come out. Now Sierra Leoneans them, let us try find out if any way they will help them. So Sierra Leoneans them in we own Hajj task force, they not be involved. But Sierra Leoneans saying we come from America, they be involved.
After the pilgrims then be don't go through the COVID-19 test, I've been later asked them for share their experience during the time when they in Saudi Arabia.
I name Ajanyama Kaba. Oh, this one is great. Inshallah, they really perform fine, good for we. The government try for we. Then do what's in the able to. Not so everything will be well, but they try. We try. We able to do. We Hajj perfectly and quietly. We come, alhamdulillah, Rabbil Alameen. We tell Allah thank you, we tell the government thank you.
My name is Abibatu Sajo Jalo. Yeah, alhamdulillah, the Hajj, we come more fine. We tell Allah subhanahu wa ta'ala thank you. The Hajj, we come more fine, alhamdulillah. We do everything, all the prayer there, all the side that was supposed to go. Alhamdulillah, we able for go there.
Na young bobo there, na impede for go Hajj. If you see say you papa with your mama them old, they want go Makkah, na for go to them. If you not go to them, you not go find for you. Either you find for pay for them, for like somebody Hajj for them. Then they right, then they are good idea.
Me na Muhammad Sireba. Alhamdulillah, Rabbil Alameen. The process it go very well. We don't go safe, we don't come safe. All man don't go, you don't come back fine. We don't do the Hajj process, all things. And the first Hajj in the ritual.
The pilgrims then end up for tell thank you to government for the opportunity we then give them for go.
The hospital include infectious agents, and so we're not put down in to the general public. So they will get incinerator them, we get ways for handle them so that you be able for completely destroy any virus or any bacteria we did it before you go into landfill. So we did manage that aspect of them. But all of the general public sanitation is in the new ministry.
So in terms of this transition of changing the health, removing it from the Ministry of Health, when I be the state of the sanitation, especially now hospital area them, because not to follow transition day or handing over, but let the other institution with the getting responsibility, not later say, well, we meet a huge tax, so it gets to take time for law able to give a result which will be reflective.
So the sanitation, not to hospital no more before. In fact, the highest number of health worker them now being sanitary inspector. In fact, the Ministry of Health is start from that side from sanitary worker them. So nearly every district, every chiefdom we can get sanitary worker where they ensure then they go around and make sure say the yard then clean, they make sure say mosquito they know they grow, they make sure say people then they adhere to then waste management. I think it's a general thing for the public. But the hospital, their own waste within they generate is slightly different from everybody else. So the state of health from the ministry side, we've been focused a lot more on the hospital waste than we've been focused on the general public waste. So I think it makes sense for let them move the sanitation come off from the Ministry of Health for going to the Ministry of Water and Sanitation. Again, I think for me, I'm gonna joke with people that will be call it MOHS. I say the S now small s, but it actually need for be capital S. And I'm glad we're in a new ministry now where they take as a capital S. We go allow you for focus on the sanitation issues within the hospital.
Is it that the sanitation aspect of the intern and the way we deal with the Ministry of Health and Sanitation are be a burden to the ministry?
No, not to burden. I mean, we have responsibility. But you know what you do? You did tackle multiple things at the same time. You know, I think there would be need for give a little bit more attention to environmental health, to the sanitation aspect. Again, where you get situation where 30 day people then they get open defecation. Now they completely unacceptable. They get major health implication. People then they get open urination. Completely unacceptable. And I think one of the things that we'll be trying to do now for completely ban open defecation, for work with people and for create their own latrine and for manage their own latrine and for make sure say every community get latrine, for make sure say every house where you build get latrine component for them. So again, I think that's an important aspect of the work. But we've been just so focused on the hospital and now we don't give enough attention to that. So I'm glad with new ministry they take full responsibility for that.
Now,
and we support them as well.
The sanitation aspects don't go to water resources. We are not left with the health. What's in the happen at this sector?
Well, really exciting at the health sector. So again, just not only the area, but the Hajj and the pilgrims and come forward. You know, we fortunately are establish a new national public health agency. The national public health agency then get major responsibility. First responsibility for prevent outbreaks of any sign. At the same time, then they prepare for outbreaks. And third, then they respond to outbreaks. So where you see like them pilgrimage, so we go, the NPHA being actively involved, first for ensure say every pilgrim we go, then get the right vaccination for COVID. Then when they're ready for come back, NPHA makes sure say we work with Ministry of Social Welfare, we work with the Hajj planners for let people understand waiting and get for meet with Nkaya. So we then come. Fortunately, we get the old terminal at the airport. We set up 20 solid workstations there for meet the Hajj people, and so that nobody they spend more than 5 minutes at one location. At the same time, when they're ready for go, we give everybody care package. We include hand sanitizers, we include masks, we include infographics for help them. At the same time, we don't alert all of the district medical team them, the district health medical officer them, all they know exactly who that they can at the district, and then they closely monitor them so that if we get any case, we'll be able to respond to them very quickly.
Now, Mr. Minister, the issue of these pilgrims that we come and screening them, is it that there is any sign of Ebola again, whether it's in the country or neighboring?
Not so Ebola, COVID.
So COVID.
Well, again, Senegal just recorded about 78 of them pilgrims then test positive. Cameroon reports similar numbers. Togo reports similar numbers. So as then here they go on, they get an abundance of caution. But again, you know, Hajj now very celebrated thing. That's something we really the pride we have in people and for go Hajj and come back. So we don't want to turn a celebratory thing into a nightmare. So what you want for do now for make sure so we follow the science very closely, but we do it with dignity and respect, and make sure so then people move smoothly, they then go back and celebrate with their family. Then.
Before we come to with Victor Lansana Kurma, Executive Director for Health Alert In, we still deal with the Minister for Health. We now Dr. Austin Demby are very careful line up with sanitation day, because it don't depart for long. But let we look at, apart from the COVID situation and the testimony they run for them, pilgrim them where they come from Mecca this year, what in the happen in the health sector in terms of for give strength to the sector as we mentioned earlier?
So I mean, something very, very transformative to go on in the health sector. Again, something in the way the public now they see, and something in the way the public they see. One of the things that the public now they see is that we don't move away from disease-focused interventions for focus on the person. All 8 million of we. And the whole they do, will say universal health coverage, which means say everybody foresee themselves inside the health system, and the health system foresee them. And the best way for do that, and they will follow the life stages approach. The life stages approach means say, we they start with Bella Woman them. All the Bella Woman, all 300,000 of them every year, we they make sure say we do everything for every Bella Woman for make sure say it remain healthy and it delivers safely. At the same time, when the picking non-born, we they therefore go beyond that notion of survival, because we do everything from when the picking at the womb till it arrives, so that it will arrive safely and strongly. We want for support this part picking, so let it go from survival now to thriving. For everything where the picking need, till it ready for school, so it ready for be school ready, till it go kindergarten. Till this picking go school, where it go school now with responsibility now for say all the school picking them, we make sure so they focus on learning. And if then they focus on learning, we don't want to let them begin deal with malaria, then begin deal with vaccine preventable disease, then begin deal with AI, then the CNA. So all of we health intervention, they focus on the school child for ensure say it ready for school. Till we go to the adult, till we go to senior citizens. So they follow the life stages approach, the life course approach, and we don't begin to see fantastic results. Just starting with the pregnancy. The kind of reduction we don't see in maternal mortality, it's just incredible. The kind of drop we don't see in child mortality, and increase in child survival, and increase in vaccination rates, it's really incredible. The introduction of school health, you can begin to see some real dramatic shifts, dramatic changes where they occur in life. We don't introduce some new vaccine them inside strategically. For example, we work on eliminating cervical cancer. Cervical cancer, we feel say a 3-step approach. First, you get a firewall where they use with the vaccination. Second, you use early detection and treatment. Third, you use advanced treatment. We don't introduce the new vaccine, the HPV vaccine. When we start with about targeting about 50,000 10-year-olds. Or we start in 2 weeks, we vaccinate about 84,000 10-year-olds. Now we don't introduce and deep into the routine services. We also just introduced the new malaria vaccine. And the malaria vaccine for Pekin and pregnant women as a focus, not to just the vaccine. We don't order about close to 5 million insecticide-treated bed nets. So when you combine the bed nets with the vaccines and the early treatment and diagnostics and care, we first of all will bring malaria rates extremely low down, and with a tracker. And for example, right now, a few weeks ago, we start the new press track.
Okay.
Press track the Cumbra
Mr. Minister, when it comes to the new transformative initiative in the body sector, well, I'll take you a bit back inside 2022 in terms of making sure that healthcare service reach everybody in the country. We soon start for do an outreach. We soon roll out a mobile health buses way for the gonna different side them for make sure say they able attend to people who can power body business. What really happen to that particular initiative there?
So the mobile bus now just really one brilliant idea where you feel say for take the healthcare to as close to the people there as possible. So we will get a partnership with the Chinese and then give 4 of them bus here. And which we do now for take them bus here, go district by district. I think so we want to see over 30,000 patients. Any side with the bus, they go all man they can. We don't learn a lot from the bus there, not only the service within they provide, but the crowd within they attract. First man in the Grigo hospital. Yeah, mostly woman them and then picking them, woman them for themselves and for them picking them, and then much more frequent at the hospital. The man the person get major trauma and get accident and get heart attack. But the bus, they attract an equal number of men, women, and children.
It's still in operation?
The bus still in full operation. I'll tell you something about the bus. The bus, for let it go out, it requires phenomenal amount of resources for let go out. Yeah. So imagine them buses. So first, the hot. The bus not the hot. They run completely because you get to run all of the equipment with inside. With the bus, they go. All the drug them all they use now free. All of the tests in the test kit then now free. So it costs close to $25,000 to $50,000 anytime we them bus and they move out. We've been very fortunate during COVID because what's been happening, we've been getting plenty of resources from COVID. We've been use the COVID resources for expand COVID vaccination. But as you expand COVID vaccination, it gives opportunity for take them bus here for go as wide as possible. We don't run out of the COVID resources now. So what they do, they find new partners, for able for help with, for move them bus here, go forward. At the same time, we get for change them, we get for reconsider the model. Because what they say, free healthcare, now free to the person where they can receive it, but somebody need for pay for them. So like I said, it costs nearly $50,000 for let them bus here go out. We work with the Chinese partner them for see if we can expand the fleet of buses, get another 17 buses, but change the model. So that the buses are not going to go far away now. Then they not each up the district. Then they move around the district. It will be part of the hospital network. So again, with the struggle, again for be honest, with the struggle for move them buses here, and every now and again, with the work with the partner them provide resources, we can move them. When the government they provide some of the resources as well, we can move them. But it's very difficult.
So now everything of the health cleaning buses they install.
No, it go on. It go on, but they go on as frequently as structured as the last time because the plan we get the last time. Now for let them go 2 weeks out, then come back for 2 weeks for replenish and resupply and maintenance. 2 weeks out, then come back. We know they do them that frequently anymore. And again, the season not they help either. But we they raise money, we they talk to partner them, and we'll raise enough money. We just say this then so it like I say it go over and beyond the individual service. For example, we see say some community day, we then see say a lot of people, nearly 30% of the people over the Canada bus then get high blood pressure, they don't know. We get some community with 20% of the people already come to the bus, then get diabetes, they don't know. We find all kinds of things inside the community. Well, wait a minute, if you get high blood pressure, now the community, you don't know. The time we they show up in our hospital, now with catastrophic failures, with stroke, with heart attack, with kidney failure. Well, we know how that only happens. So now with this bus they go out, we try for follow up with health education. For make sure say the community participate in their own education. For example, high blood pressure in the early stages, easy, but it can be managed by diet, lifestyle changes, exercise, and some drugs as necessary. And if you do that, it prevents the catastrophic failure with the canal. If you not do that, if this bus not being there for will go out and detect them here, the only time you go see them, the only time you go see them now, we then get this catastrophic failure, we then show up at the hospital. So again, the Boston are success, a tremendous success. We'll try for raise more money for able for run them. We'll try for raise more money for get more of them buses here so that they will be stationed at each of the district them.
Okay, continue for stay with me, said the program Dr. Demby, Minister for Health. We today's edition of the program Good Morning Salon, we look at the well body sector and things that the ministry don't do for improve this area. We want to welcome again Victor Lansana Kroma, and the Executive Director for Health Alert. Good morning and welcome to the program once again.
Thank you, Musa, for having me.
We don't they observe and don't they work in the health sector as civil society for a very long time. As it stands, what's in our assessment of service delivery not well bodies area?
Okay, so in my opinion, honestly, a lot don't happen at the health sector, a lot of turnaround there, because we did do periodic assessments from year in, year out. You know, let's start back. Me, one picking from 2010, way back where the free healthcare was launched by the previous government, and we done the follow-up because our organization Health Alert established since 2009, just before the launch of the free healthcare. So we done the follow-up and see the things that they happen within the health sector. We dey monitor, we dey engage, we dey do a lot of dialogue, policy dialogue, advocacy. We also do budget tracking, because which is also critical, because for we as civil society we believe say the health sector not gonna go without resources. A lot not forget say government also be done signed to the Abuja target, 15% of the Abuja target. A lot of other countries don't they do a lot of well for try for get down there, but we still get challenged and our partner. But of course some efforts is being done by government and the partners them, and we don't do a lot of sensitization. We also do training, because important for we as a human rights organization, we believe say health na a human right issue, and so therefore everybody will lay hands on patients, if you understand, for they get that human right lens, for they know say na matama they do it, and so you get to be very careful, how they do them, because one thing, any mistake we do, that mistake they not only like tell or mistake, say we tell or mistake by your style, another style, and they no with life no, where you mistake now death. So all them things they will bring that to the attention of the health workers. Will they train them what they call the right-based approach, so that they will know say when patient come at the hospital, you focus for be to the patient, because now health, now in life they do it, and now you it depend on. So they do all them things and of course policies that we get for improve on the health of the patients, and we also engage the policy makers them for make sure that them policies and they work very well, So all the activities then that we don't do mobilize, for instance, like how the minister they talk in terms of issues around pandemic or any epidemic or even any emergency situations. We also they jump on board and work with the ministry for bring the citizens awareness to the citizens, based on the situation where arise.
Before we go for the break, me co-presenter will pose a question to you for sincerely give a clear assessment on the well body sector. I mean, we'll take step by step, especially we will look at the transition of the name for Ministry of Health and Sanitation. What do you think about that change, the removing sanitation from the health ministry?
Well, now a very good idea, but of course for me, the body is still on the ministry, even though you see the sanitation components don't go to water and sanitation. But I think the ministry gets an oversight function. They get a very huge responsibility, because over the period we all see what the sanitation situation has been, and why the link they completely remove sanitation from health. Because first we look at primary health care, we look at sanitation are one of the factor where most times they contribute to somebody patient being sick, we go resort to clinical treatment, right? If this sanitation not good, somebody go contact whatever it is until you get diarrhea or get other things that way they contaminate and whatever. Also get for N, our hospital get for N. So that link there, if for be very much that nexus stay for be very strong, between the two sectors them. And so now I think say that body in the ministry no go totally pull handy, because they get for oversee what they happen. Because at the end of the day, the ball get for stop to them when somebody become infected as a result of poor sanitation or whatever it is. So that is good. Me the other way how maybe they look at in the past, maybe they look at and say, instead of removing the sanitation component, like how the ministry we don't get two ministers, for instance, deputy ministers, one minister for on the clinical, the other minister there for sanitation, right? But of course, me not to the president, so it's the president in your wisdom for things say for removal. But me feel say still the ministry get the responsibility, and not only responsibility, but they also even get the burden back You know, because at the end of the day, like I said, the instance where they give so now to them back the ball for stop. So if they just no pay that oversight and just left everything in hands of water resources, at the end of the day, when they in cases then we get for the camp as a result of poor sanitation, the burden get for the on them.
This rainy season, and most times during the rains, then cholera outbreak can happen. What do you think say, or would I think say, get for play that role? Now sanitation or the Ministry of Health in terms of prevention?
So in terms of, I don't know how the structure done there, but I still emphasize that the Ministry of Health, because you know what, Minister will agree with me now. I say when cholera begin hit, yeah, they relate to sanitation, poor sanitation. When other whatever disease will happen, we related to sanitation, they're not going to look at water resources. So the same Ministry of Health. Now in the traditional ministry, everybody they look out to us. So for me, whatever the structures are, whatever the systems, so they don't work out, it's good. I don't get a problem with that. That's a political decision. But for me, I think say the minister should be able to know, say like I said, emphasize, say therefore play oversight function because at the end of the body rests on them.
And I come to you quick on your assessment. Make a come to the minister again in terms of oversight, like what you they mentioned. If cholera outbreak during rain season can happen most times, person they pray for them, but prevention method get for the would they oversight this aspect and whose control or whose supervision role una get over the sanitation aspect we don't come on down now.
So and maybe I don't like this phrase. Don't come on down. I mean, this now one government. Now, one government and the ministry, then they work together. The minister and a very strong colleague of mine, we know they provide oversight, but we they work collaboratively because what happen, failure on them part go impact we. Failure on we part go impact them. So again, I think it's now an opportunity for collaborate, now for opportunity for expand. I mean, we main public health role now for prevent the NTR from happening in the first place, but at the same time we prepare for them, and as we prepare and so they're ready for respond. Yeah. So in the case of all the environmental impacts, like cholera, even with malaria, we work very, very closely with the sister ministry, water and sanitation, and we make sure, say, when problem come, we coordinate, we collaborate, we communicate, and we solve them together.
So in terms of the cholera issue, where my co-presenter asks you, how much on don't prepare? Because we see a neighboring region country, Nigeria, they experience that now in terms of cholera, and we see WHO don't get a measure and things are waiting for put in place. For Salon, we're now on preparation for just in case of such emergency, Mr. Minister.
So first with the NTR, they scramble, yeah. Well, now we get a whole agency with their whole responsibility now for letting us not see them. Their whole responsibility now for letting them not visible. Because as how now they see them now, so then they work effectively in terms of the preparation, which you look for now for make sure so you get diagnostic capability where they all side, which you look for now for get early warning system with triggers. What happened, the National Public Health Agency get what they call field epidemiologists, and with a non-trained and embed. Boko country then get 40, 50. Yeah, so we get over 350 field epidemiologists that we embed inside the regular primary healthcare program there, where they look for any unusual event and a trigger warning
system. So you want to say we so much prepare and then don't get all what it takes in the health sector for any emergency such as cholera or any other one?
Not in the whole agency therefore.
Okay.
So we will again the proof of the pudding they kind of eating, yeah. In 2014 we get a major outbreak here of Ebola, yeah. You know, say 2021 we get a major outbreak now Guinea of Ebola. We see any one case now, not by accident, now by how prepared we did and how we able to respond. So I know they say cholera no go come out because again when you get the alert from all sides with the heightened readiness. For example, with even this Hajj business, when they come back to the Hajj business, the fact that Senegal records 78 cases of COVID, it heightened we preparedness now. So now I make way for tackle. You know over it too. but we're able to tackle them. So again, and we're very lucky for get Brigadier Professor Fodesa for head this new agency, you know, and I don't know if you know Professor Sir, but nine are the one person we're responsible for reducing case fatalities of Ebola from 98% to less than 50%. 90 head this agency, na Salon man.
Victor Lansana Kuruma, in your frank assessment of the health sector, how you can assess them and what do you think of the well body sector as it is now?
Okay, so few things in the way probably want for analyze, because over the period we don't engage the media and the public will get serious concerns, and I think say don't they also come to the attention of the authorities, of course the minister and the team. When we talk about assessing the health sector, generally we get indicators we probably one look at, and we know to the masters and people therefore analyze their indicators, and we now within the public they raise as a concern. Now we look at, right, because over the period, you know, then they say Salon be on the bottom under the UNDP index report because we've been getting high maternal mortality. And so Master Sabi people there with the minister and the team don't they indicate say then they don't they reduce drastically, which is good for we as a country. But of course we still get issues them where we still need for address. Now over the period they do monitoring. Some of the things that we don't look at where the community they raise to where and we say they go to the facilities then we they see for we serve. Now the fact that then challenges and the burden they still come to the people. For instance, we do a monitoring 5 districts: Bonth, Pujao, Tonkolili, Falaba, you know, and Kwenadugu and the likes, where they look at if one of the projects where the Global Financing Facility, the fund, when the World Bank funded project. One thing we come to the attention of, we report now that the issue around referral is a big challenge. In fact, not only then district and they right across, we still notice ambulances them where government don't provide. You know, like how we get during the COVID, we've been acquire some of the ambulance and the way I remember vividly Leone, the president began for distribute the ambulance and they right across. But as we speak, we're not sure whether up to 50% of the ambulance that they function now. You go now, most of the facilities, they in hospitals, government hospitals, you see the ambulance and they unpack. So we try to engage key people. For instance, we try to bring to the attention of NEMS, because we know very well say NEMS now be one institution where now don't they run ambulance. The question will go and ask, what happened? For say money not did the ambulance again, they tell the money be there something at $1 and be there and make NEMS be look very attractive to referral. Because we get reports whether they, of course, in our social accountability meetings, we will bring all the stakeholders and the council, the DMO, they all people confess to we that then they pay for the ambulance services for referral, for instance, from from Matrujon for Gobo. Then they ask them for pay 700,000. Then they forgive the driver 200,000. Yeah, as stipend to the driver. This not for fear. So we begin ask, is this body now being shifted to the patient or waiting? Because the public need to be clear as to whether now their responsibility that, or at least now we know say yes, no, NEMS not they run the ambulance service again. So Ministry of Health need to explain to we why that body has been shifted to the patient, right? We are not very clear about that. That are one issue we're very critical. Again, when we engage the Ministry of Finance in one of the budget discussions, while that thing will come out again, now external referral, for instance, external treatment. We also notice the Ministry of Health, one of their budget line is very huge on just external treatment. And I think in those discussions, even the Ministry of Finance raised the concern, Ministry of Health, why is this so huge? Why? What is really responsible? So when they talk about improving health status as a country level, now would that in the benefit from the external treatment there? Now me and you or what? We really need to be clear with this. The public need to also understand. Thankfully the minister didn't hear. But that day, now the budget where the Minister of Finance also erased that concern day. Right? So what are we doing in our country for reduce and then kind of external or international treatment? People that where they go out, where they take huge chunk of we budget line at the Ministry of Health. We also look at issues around drugs, stock out of drugs. Now be another issue will come out very clear in most of the facilities. Then we at that particular time there were no drugs, and so when you engage, the issue has always been waiting relating to stock out. Now distribution at last mile has been a challenge, and waiting responsible. You talk to the councils they say, "Oh, we not get budget line now we budget for distribute drugs them." Now the Ministry of Health, in fact, in several of our engagement, social accountability engagements, the councils and they say this issue of devolve, now just by rhetorics, now just talk now much. But the Ministry of Health is never devolve. Everything did at the central level, that they dictate, that they do this, that they do that, and so we councils then we just no more in this. So again, somebody needs to understand that, right? Because these are statements where they come up from. Like how minister they say we complement each other, but then if councils they say we talk about devolution, even the personnel, even this, even that, all still in a national level, not to we, then are people just trying to escape or shift responsibility to other people? This is something we need to be very clear about, right? So now a big challenge, like I say, last mile distribution of drugs, that be a big challenge, and I don't know how the minister will respond to that, but it's still a key issue. Of course, we'll talk about the attitude of health workers. Now, one thing where I want to relate to the attitude of health workers, now the issue about PIN codes. The issue of PIN code will come up as something we're very challenging. I don't know, thankful the minister is here for tell the public how they distribute PIN codes. Wouldn't they give priority? Because again, to the health workers, when you talk to them, they tell we don't know how PIN codes are distributed. We don't know whether which metrics they use or which criteria they use for that we get. In one of the engagement, for instance, at Kailan self, the district health sister, it not be able to respond instantly. Say no, wait, like contact the DMO, do I not can talk something? I just know. When I'm a civil society, we say no, not to say we now witch hunt. We just want to know. Tell us what are the challenges. How much PIN codes they want to receive? How many people them? What are the criteria where they use for them to get PIN? All of them question we ask them in our social accountability forum, right? So, like they say, these are issues then. Despite the progress, the significant progress will not happen within the turnaround will not happen within the health sector, but these are issues we would need for bring them to the attention of the minister. He might not be aware, or some of them are aware, but then maybe he gets away while we will make it very clear to the public.
Thank you very much, Victor Lasana Kuruma. Inside the program, before the minister respond to then concerns them, as he don't pen them down, we get for do with drug distribution, ambulance system, electricity in hospitals, and other challenges them. Make we listen to the people them we then can deliver them service for within the makeup of the well body sector. We join Kabia quick on this.
The health system for long term now don't get plenty challenge inside the past year in the country, and malaria, HIV and AIDS, maternal mortality rates and other one them. Don't be one big area outside governments only get plenty challenge. For address them challenge make governments be come up with universal health coverage where this now for say people get access to medical service in the country. Where this make President Julius Maada Bio inside in first 5 years be make the health sector as one part in main priority area them and safe inside the People's Manifesto where it be used for campaign inside 2023 be make the health sector again as priority area. Where this according to the president now because of the gain them where in governments don't make now this sector. President Julius Maada Bio where he made launch the People's Manifesto been start first for talk about the gain them where in governments we don't make now the health sector.
Leone has improved and performed better on most health outcome indicators in the healthcare sector than most regional neighbors over the past 5 years. For instance, with a 60% reduction in maternal mortality rate, fewer women now die during childbirth, and more infants grow up to see their 5th birthday than 5 years ago.
But how this sector gets for work inside President Bio in second term na office, President Bio explained.
The second initiative is human capital development for nurturing skills in the 21st century. This initiative will continue to build on human capital base, invest more in healthcare as a key driver for a productive society and create equal opportunity for women across all facets of life.
What do people think about the health sector in the country?
The hospital there nowadays, first you get enough money for you able to take sufficient medical, and once you see no get money for me get good medical support, it no go easy.
I don't know if the implementations all government they put the staffs there or the nurses there or the doctors there, they will implement them. Because the reason why, what in government they say, then we go to hospital, what they meet are two different things. So this make I feel complicating. Like a certain prescribed certain medicine for you say, where you go, this medicine not there, but at times it can be inside them bag and sell and go buy for you. At the own price now where they go buy is a very expensive compared to what then they able say the government they provide. The other tablet then they go now for the malaria treatment there. At times we be see them for dinner at the hospital. At times we go there, then go tell you say no they.
Patients and they die. You the all money for let doctor see to you. Pass you go and bribe. All that day is not necessary in the country.
When they talk about free health care now, you know and they talk about where you go, you know because Panadol maybe for let get I go tell you say government not supply it. So me assessment and officer things okay with the health. Government need for do monitoring so people learn. So the one day they work at the hospital. So me and your assessment and it.
Well, the health system in this country not easy, man, not lie, because from Belle Self where they pana, where they go join clinic. If you know hold them 150, not able to join clinic. They every day where they go hospital, get for old like then 90, 80,000 because they get for spending lots. Panadol self na Panadol who they buy and not go talk about pregnancy care now. We don't say them for give we, but they need to give we na buy who they buy. You go to Pikin hospital, na a lot of challenges they facing. From the table then now, enter at the office, so they get medicine, I buy you, they buy them.
Then people here been same way so talk on our government need for improve this sector.
We need more people for can build for the hospital in our country. Because right now, it's not easy.
One thing they try for say no more. Anyhow we look at government they try. But na me too go push this country because na me too responsibility for you to see the way forward of the country. So if me too don't willing, don't ready for put things in place, we will able to fix this country. But with the plea to government, let them more work harder on that side. Let them able to try for put things in place and fix them up. You cannot say system they what they need for put in place. At least let them end cameras there for implement system. That camera what they put, it able help. When they go, they catch one or two, then set example. The other people in the afraid. But if they left us so no more, they not put camera for able implement them. At least they're able to see whether they corrupt or not. But if they left us so no more, nobody business, now the more thing they go worsen.
As far as me know, the assessment so far of the health system under President Bio, I would say a little bit. Some are improving because if you take a look at, we get some amount of infrastructures that we don't come up with regards to hospitals, built, input local, 34, and other districts that we hospitals that we not been there. Some been there, some don't improve on them. So I would say that now is positive change. I will even say that a positive development on then infrastructures and there.
Then people here end up calling government for give more support to the health sector so that Salone people and say go benefit from the well-body sector, more especially the free healthcare service for radio democracy. The report.
And we come to the Minister for Health. You don't get from Victor Lansana in concerns them, you don't take notes, you don't get from the public. The issues them we then raise are the issue of drug distribution, ambulance service, light system na hospital. The well-body workman and they sell drug secretly instead of publicly, and also the difficulty for access health experts where you seek. These are some of the concerns them, major concerns them. We come up from Victor Lansana and from the public who want to implement the programs them for. Yeah. You respond to them concern now.
Well, thank you very much, Musa, and thanks, Victor, and thanks to all of the concerned citizens. Them again, we know to mirror to ourselves, we know to see ourselves. Now other people then they tell we waiting right and waiting wrong, and so we really respect civil society for their input here. We respect the public because at the end of the day, now for the work, then for tell we if they're satisfied or they're not satisfied, waiting and monitor them. Now we responsibility for change and for able to respond to them. So you get about 5 points that we raise here, so I'll try for hit really quickly. First, on the NEMS service, the National Emergency Medical Service. Now, the primary ambulance service this in the country. At the same time, you get ambulance service there with the inside hospital them. You get ambulance service there within our private sector. You get ambulance service there within institutions like prisons. You know? One of the things that I noticed say now the NEM service get about close to 80 functional ambulances there. A few weeks ago, I give them an additional 10 ambulances where somebody donate to a brand new ambulances. And NEMS get a system where then they look at maintenance of the ambulance them, then they look at fuel for the ambulance them, and which happen we want for ensure say not only person need ambulance for go spend money for buy fuel, not only person need ambulance for look at maintenance. All of them see also need for day in advance. So we work with NEMS and ensure say they get all of their services here. We get some money from the World Bank. We get government, Ministry of Finance, have to directly fund them. We want clear so all check the way do them for let them get them resources here available.
Before you come to the other points, then quick clarification on the ambulance system.
Even on the ambulance, the struggle they get. Now when you get ambulance, then give hospital, then give district, then they're not able to maintain them. Small tire bust, they're not able to fix them. One windshield broke, they're not able to fix it. And then they run the ambulance till it die. You know, again, it's completely unacceptable. So I want to stop this fragmentation of ambulances and work with one NEMS service. We go able to get GPS system, we go able to get management structure, we go able to get fuel in advance, we go able to get maintenance culture, we go manage all of the fleet. Now we get very, very good cell phone penetration throughout the country. You get a 117 number where they truly function. And if we're able to combine the 117 and a fully functional NEM service, I think so we go solve the ambulance issues in this country. But the current fragmentation, it just not the work. It's just not the work because again the other day I see them, they get accident now, rush go to the place. By the time see them, ambulance arrived and say it come up from somebody, some mayor from some city. The ambulance car not just a shell of a vehicle. You know get staff, you know get oxygen, you know get support inside. How you go call that ambulance?
Apart from the 80 ambulance them we see NEMS get, how much the Minister of Health get on the you for run the system? I ask this because I remember the last time we, for instance, Port Authority then get accidents on the road, unless ambulance come up from Bo, can't take them close to mile 91.
So with the dynamic I say you will find out we get NEMS not to private now government institution. Yeah. So Ministry of Health not get ambulance on their own.
So that 80 way NEMS get now the only ambulance that we the country gets?
No, now the one we NEMS they manage. The hospital themselves get their own ambulance them. The other institution then get their own ambulance that within they manage. In some cases not as well.
Now patient they get right or they buy fare for ambulance or the hospitals then?
No.
In a situation this happened.
It's completely unacceptable. Again, you know, I know we did an accident early on go and you say let me go come buy a fuel for ambulance for me. So what's going to happen? The ambulance structure is supposed to be such that you get advance payment where the government they pay, the partners they pay for fuel. Yeah, but when you get a fragmented system, it just not seem for the work. Me want for collapse all of the ambulance system into one manageable system with a good 117 support system, with a good GPS system, with a maintenance culture and a fuel availability culture. You can get a single payer arrangement where the government they pay or partners they pay, but that payment get for the in advance of the service. Not so at the service. It's not fair for they put this at the expense of the patient. So that's something that why they work on. I mean, they consider all kind of options, including privatization of the whole service.
So what about the area of concern where some people say that they pay from one table to another, then just get for give something where that not supposed for be for access to the health
so we don't
care
know
service.
with the
Yes, yes, because you're really concerned them for people with
so the other issue now just corrupt practices inside the hospital. Again, we get zero tolerance for corrupt practices. Let's tell you what's going to happen. You get free healthcare free healthcare now for lactating mothers, babies, vulnerable children, Ebola survivors. So it's a small group of people then, where the government they give free healthcare for. What's in happen? You get a lot of people that we not qualify for healthcare, like me and you now. So we're not a pregnant woman, we're not a lactating mother, you know, but we still need the care. So what you would try to do now for build a PPP, public-private partnership, where you get a pharmacy inside the hospital, where you get standard drugs, we get price control associated with it. You ensure say the all of them product and they up to date. So we don't begin pilot that. We don't do that in a Connaught Hospital. We don't do that in a Port Loco, in a Bow, in a Kenema. So we did completely change this paradigm such that now you get a private sector. We get a deal with the government. We're able for supply products. We're complementary to the free healthcare products. With people that we not qualify for the free healthcare, we will get access to that. The third component of that now, we try to build health insurance, where you go pool the resources. So we get Slushy, where in the next couple of months, I think so we go formally launch Slushy. Slushy, they allow you for pool resources. We go allow people that we not qualify for free healthcare. We not get able for pay out of pocket. We go able for use the insurance scheme where they don't pay for in advance for able to provide services. So that way they would look
what
at
about the challenge for access, expert doctors?
Okay, so that's now really important question. That's now the international travel where people they go overseas for international help. Again, what's in the happen? We get a panel of doctors that they evaluate every case for see how serious the case they if we're able for manager now for see if they qualify for let them go overseas. Right now, they pay over $2 million a year for their overseas travel day. Mostly they go Ghana and India. We want to stop that because what's in the happen? We they pay for let them go build the strength of Ghana, let them build the strength of India, then capability where we know able for build our own strength there. So we want to convert that money there for able for build our own health facilities here, for build our own health infrastructure, for get postgraduate training there. So and for able for because right now it costs you about $22,000 for support one person for go overseas, whereas it costs you $46 for one person now for the healthcare per capita. So we want to change that paradigm. Now make we build new hospital them. Now make we build new expanded postgraduate training. Now make we right now in fact we build one new hospital in Kerrytown we don't secure about $50 million for. Now make we get this Normally hospital. Now make our defend funds for able for establish a brand new $100 million hospital like Demby in the middle of the country.
You say plenty of people in the go overseas for medical. You da among them people in there or now they do test?
Of course not.
Now they do medical.
I've been sick now so a couple of months ago, yeah. And I go Connaught, I get tests, I go Choitrams, I get tests, I get an MRI done here, so I get the best doctor them.
So all the treatment government hospital as they do?
All my treatment in Asuna, either government or private sector hospital inside Salonia. But not the same doctor they will deal with. Again, I'll tell you something. I don't know, Musa, you don't go Connaught lately?
Musa,
yeah?
Yes.
You don't go Connaught lately?
Yes.
All of the best doctors in this country, yeah? Now Connaught in the practice. They can go even time and go Mamikoka and other places.
When that Mamikoka they make them not can get time for them patients.
No, because they put in due now the central government facility. Again, but people not really fully utilize them. But what they say now, we they convert all of that money they spend for go overseas for bring and come in.
Okay.
So we'll build our own hospital. And by the way, I'll tell you something. 3 years ago we start here. Sierra Leone they produce 50 doctors a year. Then they enroll 50 doctors a year. We are challenging Professor Wuri. We raised that number of enrollees to 200. From 50 to 200. Last year they enrolled 300. This year they enrolled 700.
Okay.
So again, what do you mean they do now? As then doctor they train. and they try for build modern facility then for them so that when they graduate, they get side for practice. We're not going to get anybody for go overseas again.
The producers then, because of the challenge we'll get earlier, don't add 10 minutes to this program. We'll go use for read una text messages them inside the program. The first one I go take now say, Dr. Demby, do you know the hospital cost recovery drugs are more expensive than those in the local pharmacies? This now from Kinsolo, now 0779819819.
This one on our Facebook page for Zika, the interview we get for do with ACC, we then drop Jaya in case they say, oh, the Anti-Corruption Commission, Paran, on a no sinatin, now Jaya Kai, on a no sinative, now be opposition, so on a go see something.
This one said, Dr. Austin, you are my belt health minister, but your nurses need psychological training for your good work to come to success.
Another one said, Dr. Demby, the way you're saying things is not the reality at hospital. Behavior of some nurse is one that is so not good to talk about. The manner and way they talk or address a patient when they go to the hospital is so discouraging.
We'll continue to look at more messages. They say, good morning, Radio Democracy. Musa, I take me picking for Gona Kiyama Road Government Hospital to God, and this day waiting I see no good at all. Tell the minister, say, make they know they tell you waiting happen.
This one from Patrick Musa Momodu on our Facebook page says, Mr. Minister, I want you to know that the free healthcare is not effective. My wife joined clinic at PCMH. Anytime she have appointment at the hospital, I give her less than 200 millions. If not, she will be there for the rest of the day unattended to. So government should stop of the proud of the free healthcare.
This is a good morning, Mr. Minister. I am concerned about the shortage of blood and other supplies in the National Safe Blood Services. What are you doing to improve the situation and manage concern donor?
This one from a Facebook page from Selu Zombo, they say, if government of Sierra Leone give more pin code to nurses, this will lessen some of the criminal act.
This one say the health sector is the worst managed ministry, and the minister is not saying what is happening. Service delivery is poor and worse. Drugs being sold. The hospitals are filthy. Number of women dying at birth growing and without or being underreported. Just the first quarter of this year, over 35 pregnant women have died giving births at the PCMH or Cottage Hospital.
This one from Samu Masakoi, they say, Dr. Austin Demby is one of the best ministers, but trust me, he alone cannot do everything. People should act on integrity and also act on the oath they took before they work in the sector.